Good morning. I'd like to start by thanking the organisers for inviting me to this talk today. My name is Karen Munhall and I am a Haematology apheresis specialist nurse in Galway. I'm going to speak about the process of stem cell transplant in Galway University Hospital. What are the reasons for having a stem cell transplant? Reasons for having a stem cell transplant: if it facilitates the administration of high doses of chemotherapy. However, high-dose chemotherapy lowers or suppresses the ability of the bone marrow to make blood cells, and therefore stem cells are needed to restore bone marrow function. When your stem cells are given back to you through a drip infusion, they will rescue you from your high-dose chemo. Your stem cells will travel to your bone marrow, where they will grow and begin to make new cells. Your doctor or nurse will, where they will grow and begin to make new cells. Your doctor or nurse will call this engraftment, which means the stem cells have settled into your bone marrow and are now going to grow. High-dose chemo and stem cell transplant after induction therapy improves response and overall survival for patients with multiple myeloma. Lymphoma, testicular cancer, and multiple myeloma are the most common causes of the cancers that we use for doing stem cell transplant for. I have used the word rescue here, as the word stem cell transplant can sound quite scary. This type of treatment is more of a rescue than a transplant. There are two types of stem cell transplant. There is an autologous and an allogenic. An allogeneic, the stem cells come from a donor. The donor can be a close relative or an individual located through a national donor registry program. Autologous, the stem cells come from yourself. Most patients with multiple myeloma receive autologous transplants. An autologous stem cell transplant allows you to have higher doses of chemotherapy than usual to treat your disease. But such high doses of chemotherapy will destroy your bone marrow. An autologous stem cell transplant uses healthy blood cells from your own body to replace your damaged bone marrow. What are stem cells? Stem cells are blood cells that are at the earliest stage of their development. They can develop into red blood cells, white blood cells, and platelets. Red cells carry oxygen around your body. White cells help to fight infection, while platelets help blood to clot and prevent bleeding. These stem cells are found in your bone marrow, which is a spongy tissue found within the bone, in particular your hip bone. Bone marrow makes all your body's blood cells. There are 4 main hospitals that provide stem cell harvest and stem cell transplant within the Republic of Ireland. Galway University Hospital, we have a dedicated haematology inpatient unit called Claddagh Ward. It is a new unit, approximately 2 years old. There are 25 single isolation rooms and it is a HEPA filtered unit. In Dublin, there is St. James's Hospital, St. Vincent's University Hospital, and for children, there's Crumlin Hospital. This graph highlights the increased numbers of stem cell transplants that have been carried out in Galway University Hospital. I've gone back to 2011 with the graph. As you can see, in 2011, we carried out just under 20 stem cell transplants. Just over 20 in 2012, as the numbers have increased through the years, as you can see. Over 60 autografts were carried out last year in 2019, and we will have over 70 autografts carried out by the end of 2020. In Galway, we cover for patients all the way from Donegal down to County Kerry and County Cork. This is an idea of the pathway that you will follow once you have been referred for a stem cell harvest stem cell transplant. It is an outline of the pathway that you will undertake. I will go into more detail about harvest and transplants as well. A referral will be received within the Galway University service or from your external hospital. We then book you in to be seen by your consultant in outpatients. Here you will receive a lot of information about stem cell harvest and stem cell transplant. You will be fully reviewed and the process will be fully explained. And you will receive contact details of people so that you can contact us if you need to ask any questions. You will also receive at this point a provisional date for your stem cell harvest and stem cell transplant. The next stage is to receive your high-dose chemotherapy, stem cell mobilisation, and for your cells to be collected. The stem cell harvest. This is the stage where we mobilise your stem cells. 90% of stem cells are found in the bone marrow and 10% in peripheral blood mobilisation and 10% in peripheral blood. Mobilisation is the process of increasing the number of peripherally circulating stem cells so that they can be collected using an apheresis harvest procedure. Stem cells are mobilised from the bone marrow into the bloodstream using growth factors called GCSF and chemotherapy. Chemotherapy is given to both treat the disease and to mobilise the cells. We all have stem cells in our bone marrow. During a harvest, we need to produce these stem cells at a much greater rate. It is important that the GCSF is continued daily until harvesting is complete. The high-dose cyclophosphamide is given on day 1. It is a 2-hour IV drip. GCSF will start on day 2, 24 hours after the high-dose chemotherapy. You will then be discharged home and readmitted again a week later for your stem cell harvest. The main side effects from mobilisation are 1, bony pain. This bony pain usually comes across the chest, down the back, and down the legs. It is a spasmodic type pain and it is caused by the GCSF. Paracetamol is very effective and can be given in this situation. Also, the chemotherapy can irritate the lining of the bladder. We give an infusion called Mesna with the chemotherapy to coat the lining of the bladder, which will protect it. Collecting the stem cells is called harvesting. For the harvest, you will have a central line inserted into your neck called a vas cath. The stem cells have now moved into the peripheral bloodstream. The stem cells are collected using a machine called a cell separator. The machine spins your blood at high speed to separate out the stem cells. You will notice on the day of your harvest that the machine makes a low humming noise like a washing machine. The spinning allows your blood to separate into layers. The layer with the stem cells is selected and collected into a sterile bag by the machine. Also, the machine will remove some of your plasma cells, usually about 300 mils. Plasma is the name given to the pale yellow liquid part of the blood minus the blood cells. All of the remaining blood will be returned to you. Once you are connected to the machine, you should not feel anything. A nurse will be with you during the harvest, and you may be harvested from 1 up to 3 or 4 days. What are the side effects from the harvest? Certain side effects that can occur are mainly due to the change in the amount of blood in your system and the anticoagulant used. There is approximately 200 mils of blood spinning through the machine at any one time. Having slightly less blood in your system may cause you to feel slightly lightheaded, dizzy, or perhaps nauseated. If these occur, they can be easily treated. The anticoagulant used keeps the blood from clotting in the machine. But as the blood is returned to you, it will contain some anticoagulant. The anticoagulant may drop the calcium level in your body, causing a sour or metallic taste in your mouth. You may also notice some tingling in your lips and fingertips, and this can be treated by administering IV calcium or just giving a calcium tablet, or simply a glass of milk may help. After the procedure, you may feel tired, but this will ease off once you've rested. This is a picture of the Optia machine that we use to collect your stem cells. This is the cell separator machine. It will be brought into your bedside. And this is a picture of an example of a bag of stem cells. So, when to harvest? Every day your bloods will be checked, and a special blood test, which is known as the CD34 count, will be checked daily. This indicates the number of stem cells in your peripheral blood. Once this is at a desired level, the harvest will be commenced. Whole blood is drawn from the patient and it is separated within the machine. Other components which are not required are returned to the patient, so the machine will only collect what it has been asked to collect. It is a 4 to 6 hour procedure. Approximately 200 ml of stem cell product will be collected and approximately 300 ml of plasma will be collected. And as I said, everything else will be returned to the patient. A lab technician will come and collect the cells after the procedure is finished, and they use this plasma in the lab to process and freeze the cells. What happens when cells are collected? Once the collection is over, the stem cells will be removed from the machine. About 200 to 300 ml of stem cells are collected per day. You will get the chance to see the stem cells if you wish. From there, the cells are brought to the lab, where the number of stem cells in the bag is counted. The stem cells are then mixed with a preservative called DMSO and frozen. This freezing is known as cryopreservation. Once frozen, the stem cells can be frozen for many years. The vas cath will be removed once we have enough cells collected. It is important to mention that consent has to be taken before your harvest can be started. So on admission for your stem cell harvest, you will have a consent and other forms to sign. We are governed by the European Directive in relation to the storage of human tissue, and they tell us we have to do certain bloods and have to fill out certain forms within a certain time frame. They have to be sent to an accredited centre, which is Galway University Hospital, and we have to get your consent to carry out the procedure, which allows us to harvest and freeze your cells. Here is a list of the workup that will be carried out before your stem cell transplant. Some patients, before the transplant is carried out, will receive further treatment post-harvest, and other patients will go straight to high-dose chemotherapy and transplant. This is a consultant's decision. There is a list of tests here that will be carried out before your transplant will be undertaken. This will ensure that it is safe to proceed and that we are not doing any harm. First, there is pulmonary function tests. These are PFTs or lung function tests, and they show how well your lungs are working. It involves blowing into a machine. An echocardiogram is an ultrasound of the heart. The procedure itself is a small amount of gel that's put on your chest, and a probe will be moved around your skin on your chest near your heart. This test takes 20 minutes. You will need to have a dental assessment undertaken before your transplant, a dental checkup before you have high-dose chemotherapy. A dentist needs to check your teeth. Any decay can cause serious infection during your transplant. A Hickman line will be inserted before your chemotherapy. This Hickman line will be used to give high-dose chemotherapy, your stem cell reinfusion, and any supportive care that you need post-transplant. 24-hour urine collection. This test checks how well your kidneys are working at clearing waste products from your body. The result of this test is used to dose your melphalan. A chest X-ray will be taken. This is a baseline X-ray of your chest to check for any lung problems you might already have. An ECG is a tracing of your heart rhythm. So once all these tests have been checked and reviewed by your consultant, you will then be admitted then for your high-dose chemotherapy and stem cell transplant. So this is the next stage of your process here. So you will be admitted to hospital, and in GUH you will be admitted to Claddagh ward. You will receive your high-dose melphalan at that stage. Claddagh ward is specifically designed to look after patients needing a stem cell transplant. Each patient has a single room with en-suite facilities and television. The air on the ward is specially filtered, which means that it helps prevent or reduce the risk of airborne infection. The system also allows the air temperature of the room to be changed as needed. Usually you will receive IV fluids the night you are admitted and high-dose chemotherapy the following day. Once the chemotherapy is finished, you will have a 24-hour gap before the stem cells are reinfused. The stem cells will be infused back to you at least 24 hours post-chemotherapy. Giving the stem cells back is known as reinfusing the stem cells. The day you receive your stem cells is known as day 0. The cells are thawed at your bedside by a lab scientist using a water bath. Once thawed, the stem cells are reinfused through your central line. Receiving the cells is like having a blood transfusion. Usually the infusion lasts under an hour. Each bag takes 5 to 10 minutes. The number of bags to be reinfused depends on the volume and dose of the stem cells harvested. So, what are the side effects during your reinfusion? You may notice a strange taste and smell during or after the infusion. The smell is like garlic or sweet corn. This is due to the DMSO, which is a preservative used to protect the cells whilst in storage. It is nothing to worry about, and the smell and taste will clear within a day or two. You might also feel some nausea. Your urine may be red coloured after the return of your stem cells, and this will disappear after a few hours. Patients are routinely put on telemetry whilst undergoing the reinfusion of stem cells and for 24 hours post-transplant. What happens after the reinfusion of cells? After your stem cells are reinfused, you will start GCSF injection. This is a growth factor that will boost the growth of the infused stem cells and help them mature. These injections start 24 hours post your stem cell reinfusion. You will remain on these until your blood counts have recovered. You will need to wait for the stem cells to move into your bone marrow, and this happens gradually, and it is called engraftment. During this time, your blood counts will be low, and you may need transfusions and antibiotics. Usually, After 10 to 21 days, your white blood cells will start to recover. Daily blood tests will be done. So, care of the transplant patient. One of the blood tests that will be checked on a daily basis are your neutrophils. These fight infection and they will become very low at this time. Because of this, you will be more prone to infection. For this reason, you will be nursed in isolation. In general, visiting is restricted while you're in isolation. This is to reduce the chance of you and other patients picking up an infection. Hand washing is vital, and visitors with any signs of infection should stay away. This is particularly important if they have been around anyone with an infectious disease. A healthy diet is important when having a transplant. Good nutrition can help to prevent you picking up any infections. This is why you should try to eat even if you have nausea or lose your appetite. The dietitian can and will discuss the best way to deal with these problems as they arise. It can be hard having to stay in a small room all the time, but it is important to be as mobile as possible and to keep your muscles working. It is also important for your lungs. Do get up and walk around the room at least a few times a day. Day 0, when you receive your stem cells, you will be more than likely feel very well. You may feel a little bit nauseated. It is the days after this that you will start to have the side effects from chemotherapy. You are an inpatient at this time and you are recovering from the high dose of chemotherapy. These days from day +2, +3, +4, these are the rougher days. And the chemotherapy has started to take an effect. The main side effects are a drop in blood counts. Your red cells will drop and you may require blood transfusions to boost your red cell levels. Your white cells will drop and this will make you more prone to infection. At some point during your admission, you will be more than likely require IV antibiotics due to a high temperature and infection. Your platelets will drop and you may also require platelet transfusions. Nausea, vomiting, diarrhea are all common side effects of high-dose chemotherapy. But you will be given anti-sickness medication to control any nausea and vomiting that you may have. A sore mouth and gut, which is known as mucositis, is the name given for inflamed or irritated mouth or gut. Your mouth might feel sore and get ulcers, and these can develop often after receiving chemotherapy drugs. Painkillers will be given to you. Use a soft toothbrush. Keep your lips moist with lip balm. Use regular mouthwashes as advised by your nurses, and these will be provided. Use mouth sponges instead of brushes if your mouth becomes very sore. Alopecia or hair loss due to the high doses of chemotherapy. You may lose your hair. You might get total hair loss or just thinning. It does come out in clumps, so if you have long hair, you might prefer to cut it up some. There are many companies that provide wigs, turbans, hats, hair pieces. Your hair will start to grow back soon after chemotherapy. Be assured that we are all very experienced with managing these side effects, and everything will be done to ensure that you are comfortable. Once your blood counts have returned to normal levels and you are eating and drinking well, you will be allowed to go home. This is usually about 10 to 21 days after your transplant. But remember, everyone is different and the time period can vary depending on your recovery. For the first few weeks after your transplant, you may have to return to the day ward for blood tests and follow-up. Your central line will be removed before you are discharged. And there will be a restaging after 3 months. This may include CT, PET scan, and a bone marrow biopsy will be repeated. It is important to mention that even though you have recovered at this point from the transplant, your energy levels will be quite low. Fatigue can be frequent and unpleasant side effect of chemotherapy. You will probably find that you have no energy and do not feel like doing anything at first. Gentle exercise can help, but try to balance activity and rest. Be kind and gentle to yourself, and you will get there. It just takes time. I leave it there. Thank you very much, and I am happy for any comments or to answer any questions. Thank you.